I'm going to show you some data that really gets at what you can find from ADPH. As we start to move forward, and I know summers are going to be busy and people won't be here, I wanted people to have the ability to look at the data whenever they wanted to look at it, and know how we're doing in real time as we evolve for the summer. This is the case data chart that ADPH puts out there. It provides a 14-day average, a 7-day average, a 3-day average, and then the daily case counts. If you go to their website, and as soon as I go through the quick PowerPoint, I'll show you how to get to the website and navigate to find these things. This really gives us a feel for what's going on. And you can see that cases are really continuing to decline. They flattened out for a while after steep declines in February and early March, and then now we're declining again in the last 3 weeks. By age, this is a different story. We're really seeing the oldest folks starting to pull away from the younger age groups, and these were right on top of each other for most of the year. But you can see in the populations that are most heavily vaccinated, we're starting to see pretty steep separation. Interestingly, that 18 to 27 line is really starting to come down as well. One of the things that's nice about what ADPH is doing that you can track, it used to be they lumped everybody 16 to 54 together, but just this week they updated their website, and check this out. 18 to 29-year-olds are pursuing vaccination at higher rates than 30 to 49-year-olds. And it's showing up in their case data. Like I just showed you, their case data is coming down, where those the 30 to 49-year-olds are still remaining very flat. So who knows why this is? Thank goodness for the I generation, or Gen Z, or whatever they're called. Apparently they are willing to get vaccinated, or maybe they want their college experience back. Who knows? Overall snapshot of what's going on in Alabama right now. Everything is really decreasing, with the exception of the hospital ratio. And that's the only thing that I've been watching that makes me kind of wonder, are we missing cases? Are the mild cases not being reported? Because there are starting to be more people in the hospital than we're actually seeing cases. So that just always makes me question whether or not we're grabbing all cases. These are the monthly hospitalizations by age. And again, this is really important data. In April of 2021, for the first time ever, there were more hospitalizations in 16 to 34-year-olds than 75-year-olds and older. That dark gray line really plummeted as this group started to get vaccinated. And you can see the 65-year-old line is following suit, but that 35 to 54 and the 55 to 64, they're kind of staying flat for the last couple of months. So this is definitely an indication of the vaccine, that it's working in those certain subgroups. And I'm going to post in the chat so you all have this, the ADPH website where you can go and track it. The number one question that I always get asked is, are we at herd immunity? Which is such a funny concept because we can't measure herd immunity per se. But the way that we would track it, if we were going to track it, is that we would look at the cases. And let's see if I can find the screen I want to show. There we go. This is the ADPH dashboard, if it'll reload here. But if you wanted to know when we would start to feel pretty good about where we are, if we can sustain 200 cases per day and get less than 200 hospitalizations in the state, we're probably in a very good place. That corresponds to roughly 5 per 100,000 cases, which is what people have always estimated was an indication of low case burden. So that's the goal, is to get us down to about 200 cases a day. If this would pull up, we might be too close to their update time. You would see that we're close. We're not there. We're not quite at 200 cases. Last I checked, we were at about 215 cases per day. On the dashboard, you can see at the moment we're sitting at 2907 cases. So we're not quite less than 200 a day, but we're really close. If that were under 2800, that would feel great. And that's just right here on this first data and surveillance tab, if you go to it. Then if you come down to tab 9, this is the hospitalization tab, so you can always kind of be aware of where we are. If you scroll it all the way to the right, you can get a better feel for where we are in the state in terms of hospitalizations. We're at about 278 right now. Again, to really think that we've got the cases where we want them, we'd like to see this under 200. But it has been steadily coming down, albeit very slow. You can see here since about March, it's really struggling to get down below 200. But overall, things do appear to be going in the right direction. Memorial Day is going to be our biggest test. If we see cases continue to stay low, even after Memorial Day, that'll be a good sign. And we should know that around June 10th.
There are some changes coming to the case investigation contact tracing project. I've been advised that Tuesday of next week, I'll believe it when I see it, an amendment to our contract will be signed, and that will give us the go-ahead to begin assisting previously patients with under investigation that previously had COVID-19, a positive test of COVID-19, and had a case that we investigated. We'll begin assisting them and members of their household and their contacts with making arrangements for vaccination. So that will be a major change. It gives us something else productive to do. As Suzanne pointed out, the case count has declined significantly. It varies on our side from day to day quite a bit. 2 days ago, we were assigned 136 cases to investigate. That's basically the capacity we had for that day. Today, we were assigned 56. That is 24.5% of our capacity to investigate today. So we have some idle time of our investigators, and hopefully beginning next week, assuming that we get the contract amendment signed here at UAB, then as you may know, ADPH requires wet signatures, so then it has to be placed in the mail and delivered to them and goes through their system until it gets to Scott Harris, and then hopefully he'll sign it on Thursday, or by Friday we should be in business of assisting with vaccine appointments. We have developed a system. We are prepared to train it. As soon as we get a signature from UAB, we're going to start the training process. So hopefully we can begin that on Wednesday of next week.